Welcome to the Myrna Method livestream. I'm registered dietitian Myrna Haag. My goal is to bring you impactful nutrition information that can significantly change your life. What we're going to talk about in this video is calcium, and really how calcium, just like everything in your body, needs to be on a system of balance. Now, a lot of times when you have issues with disease or irregular states in your body, it's because you're not in balance. Something's not right. Your body's not in a homeostasis. And one of the most impactful ways you can create this homeostasis, get the body in a balanced condition, is through your diet. It's one of the most impactful ways. But what a lot of people don't understand is that diet needs to be balanced. The entire body is in a system of feedback loops and balance. And the macronutrients, which are protein, fiber, carbs, and fat, those I talk relentlessly in all my podcasts, how those need to be properly balanced. But same with the micronutrients, which are the vitamins and minerals. So what we're going to do in this video is explain to you how calcium can't do its important function unless it's properly balanced. And this could be a really good reason why we see a lot of calcium intake, but we're seeing a high rate of osteoporosis and osteopenia. Because it's not just about calcium supplementation, but the balance of calcium in relationship to our bodies and other minerals. So Sam, if you're ready, let's dive right in. So first of all, let's talk about the vital role of calcium. And then we're going to look at the hormonal regulation and what happens with the inadequate levels. The key there is balance. You have to get the right balance of all these other minerals to be able to get calcium to be a property of bone formation, what it can do, but what it won't be able to do unless you provide the right dietary balance. And then we'll talk about some supplement strategies. We'll look at some food with calcium. Bottom line, calcium is an electrolyte. And why is this important? Because your body is going to want to always have a certain amount in the blood. That's just what electrolytes do. And the reason why is because electrolytes do a lot of other functions. And they need to be in the body 100% of the time. So if your electrolyte imbalance is off, you're going to have processes in the cells that just won't function. That simple. Calcium is one of the most important electrolytes. In fact, when you don't have enough calcium in the blood, the body decides no problem there. If you're not getting enough calcium from your diet, we're going to steal it from your bone. So that's one really important fact. And the body has a natural way of doing this through a hormonal regulation. So the body likes to keep a homeostasis with calcium because too much calcium, which we'll talk about, can be a problem. Not enough calcium is also a problem. So when calcium levels become too high, the thyroid gland releases calcitonin, which then stops bone breakdown. So calcium's high in the blood, and the thyroid kicks in calcitonin, which then increases the kidney's excretion of calcium. It reduces the absorption of calcium in the intestines, and it tells the bone, hey, stop breaking it down because we don't need it. And the opposite happens when you have low blood calcium levels. The parathyroid then releases the hormone called parathyroid hormone, and this stimulates the bones to release calcium and put it in the blood. It also tells the kidneys to slow down releasing calcium. It gets reabsorbed. The gut becomes more enhanced in absorbing calcium, and even vitamin D is more activated. So your body is like on red alert, and that parathyroid and the thyroid are the two glands that are constantly regulating this tight response, this feedback loop, to make sure that the blood always has that electrolyte calcium. So bottom line, bone loss versus blood calcium. You're never going to see low calcium in the blood. Well, if you do, we know then that parathyroid's having some difficulty. So you could get the calcium reading in your blood and you think, oh, it must mean my bones are great. actually can mean the opposite. We don't really know what it means. So you can have normal blood calcium levels, but still be experiencing bone loss. And calcium is huge for survival. Heartbeat, nerve signals, muscle function, blood clotting. So this is a huge priority for your body to maintain levels of calcium. But calcium levels, as far as bone growth, don't tell the whole story, because bone building requires more than just calcium. So even if you have plenty of calcium, if you don't have proper vitamin D, magnesium, copper, zinc, even vitamin K, insulin growth factor, which is having to do with proper glucose in the blood. So if you're a diabetic, there could be some bone loss there, and physical activity. So the body actually needs to have this balance of these other minerals. And I say that because it's not about megadosing, because what I want to show you in this video is you might think you can just megadose on these, and in a lot of cases, if you have too much of some of these, it can even throw off the balance of the calcium being able to work with this mineral and providing bone growth. So bone growth isn't just about getting calcium, but understanding it's a balanced situation. So if you have deficiency levels of magnesium, potassium, vitamin D, K, copper, and zinc, or you have elevated levels of phosphorus, sodium, this can compromise the bone growth. And so what does the body need? And we'll go through some of these, but approximately in magnesium, 300 to 400 milligrams. We'll talk about, you get that a lot in food already. Vitamin D, anywhere from 1,000 to 4,000 IUs, and that's going to be based on that lab value, right? So when you go to get your labs, you want to ask for a vitamin D test. You want to see where you are there. Vitamin K, 100 to 200 micrograms. That can easily be supplied in a 1 cup of cooked spinach, easily, right? So vitamin K is in a lot of leafy greens. Copper, which is in most foods, 900 to 1,500 micrograms. Zinc. So most of these, boron and phosphorus, calcium, again, these are the main minerals. They're so important in many other functions. So we could have a video on each one of these. But calcium, in relationship to having a balanced homeostasis with these minerals, are super important for you maintaining bone health, or actually bone growth. So let's start on some of these minerals and talk about what happens when we have an imbalance. So if you have an inadequate intake of zinc and copper, even if you have enough calcium in your blood, this can affect bone growth, because zinc is crucial for collagen synthesis and bone mineralization. It actually helps the bone-forming cells do their job. Copper is essential for the cross-linking of the collagen. It actually helps provide the strength within the bone itself. And a lot of times with zinc, copper, and iron, if you are getting too much of one, you may not be getting enough of another. In other words, let's say you have a cold and you're really, taking a ton of zinc, or maybe you just think you should be having excessive amount of zinc to improve your immune system. The problem when you do that, zinc, copper, and iron compete for the same receptor site on cells. So if you're taking a lot of one, then you could be actually causing a deficiency in another, which isn't good in itself, because having a deficiency in any one of these minerals can also lead to imbalances that affect your health. But in this video, we're just talking about the relationship to calcium with these other minerals and building bone. So taking a lot of zinc, you compromise your copper, this can actually affect bone growth. Not with iron. I'm just showing that zinc, copper, and iron compete for the same receptor site. So yeah, if you're flooding yourself with a lot of zinc, you're taking a lot of zinc supplements, you could have a copper and iron deficiency. But in relationship to bone growth, not getting the right balance of the zinc and copper can absolutely affect the mineralization and the collagen synthesis. So it's important to understand that the body wants you to have the right balance. And then when I talk about insulin, and I'm talking about the insulin growth factor, this is also required for bone growth. So improved insulin regulation is closely linked to better insulin growth factor. And by the way, that's what's essential for growing muscle and growing bone. So when you have insulin sensitivity, like high blood sugar, like what we see with diabetics or even insulin resistant, you are going to have possibly a correlation with bone loss. A balanced diet that includes the appropriate amount of carbohydrates actually helps regulate insulin secretion, which in turn influences the insulin growth factor levels. So carbohydrates actually stimulate insulin release and can actually increase the production of the insulin growth factor. A lot of people don't realize everybody wants to eliminate carbohydrates from their diet, but in a lot of my podcasts, when I talk about eating a balanced diet, I reference how important these macronutrients, protein, carbo, fat, and fibers are. And in this case, I'm highlighting how even with insulin and regulation and how important it is to balance those carbs, not eliminate them, but carbs are also important for regulating your blood sugar. And a lot of people don't understand this because they're so convinced that they have to go on a diet of low carbs to regulate the sugar, when actually it's about a balanced diet. But in relationship again to bone health, showing that not knowing how to do a balanced diet in relationship to the macronutrients, particularly fats and carbohydrates, can affect bone health. In this study, it talks about the effects of low carbohydrate and high fat diets on the digestibility of minerals. And this study was done in rats, but they showed that when a high fat diet is consumed, some of the fat could possibly not be fully digested, which can happen in high fat diets. This can break down into these free fatty acids in the gut, and these free fatty acids bind with calcium and create these calcium soaps that inhibits the absorption of the calcium from the intestinal tract. So not having a balanced diet, in this case showing a high fat diet, can cause calcium absorption to lessen in the gut. But a high blood sugar, when you have a lot of sugar in the blood because you're not regulating that insulin with a proper balanced diet, this can cause a deficiency in your insulin growth factor. It actually can lead to less bone growth and actually less muscle. And this is a lot of times what we'll see with diabetics. So they call it diabetic bone disease, and it's a form of secondary osteoporosis, and it's characterized by weakened bones, which increases risk fractures. And this happens especially with patients with type 2 diabetes. Once again, highlighting the importance of having a balanced diet. So why electrolytes matter for bone growth, even though it is tightly regulated, we need these key minerals, calcium, phosphorus, magnesium, sodium, potassium, and how they are balanced in our blood and relationship to each other affects how well we grow bone. So critical calcium mineral relationships. Let's talk about the relationship between calcium and phosphorus. The blood likes to maintain an equal percentage of phosphorus to calcium. Now, phosphorus and calcium we get from the foods we eat. So all the foods you eat will have a certain amount of phosphorus, not so much calcium, but most likely most foods you consume will have phosphorus. But when you have an excess of dietary phosphorus and you have low dietary calcium, that parathyroid will pull calcium from the bones to equalize the ratio of phosphorus in the blood. So what I'm saying here is if your blood shows high levels of phosphorus and low levels of calcium, then that parathyroid wants the blood to have a 50-50 equilibrium. So having a high phosphorus electrolyte and not enough calcium because you're not balancing your diet, this in itself can be a bone puller, right? It can pull calcium from the bones. So in relationship to the diet, and we'll go through some foods that have calcium, phosphorus, and you can see what I'm talking about in relationship to this. Actually, let me just go ahead and take you there, and I'll come back because while we're on the topic. So in this chart, I show that when we look at phosphorus for beans, lentils, lima beans, tofu, vegetables, spinach, collards, turnips, most of these foods have very low phosphorus, like we're talking about 80 or 150 milligrams. The amount of phosphorus you need for the day is anywhere from 700 to 1,200 milligrams. We get more than 3 times that with the typical American diet. And I want you to think of that a minute. We get more than 2 to 3 times that with the typical American diet. And why is that? Well, if you look over here on this chart, I'm showing chicken, fish, oysters, shrimp. These have very high phosphorus, but very low calcium. And even breakfast cereals are high in phosphorus and low in calcium. Although in a lot of our breakfast cereals, they are fortifying them with calcium. Why is that? Because they already know there is an imbalance there. We have a lot of phosphorus in foods like dairy foods. Yogurt has 320 milligrams of phosphorus, but it also has the equal amount of calcium. But what's really interesting, if you look at this chart, a lot of plant-based foods have low phosphorus and high calcium. Or I should say some calcium, not super high. So a lot of our foods that are from plants, the plant kingdom, don't have as much phosphorus as a lot of our processed foods and high animal foods. And that's something to kind of keep in the back of your head. High animal protein diet typically will have lower calcium and higher phosphorus. So if you do a high animal protein diet and you combine that with high processed foods, you're on a real high phosphorus diet. And if you don't know to supplement with calcium or combine it with calcium foods, you're going to have this calcium and phosphorus imbalance, which is what I'm referring to in this slide. And because the phosphorus is elevated with this type of diet, it creates a bone steal. And when we look at calcium and magnesium, well, we need both of those for bone growth, but there's also a balance with magnesium in relationship to calcium. The body doesn't want just excess magnesium because excess magnesium can disrupt the body's ability to bone growth because it wants, again, the right balance. Also, calcium to sodium. So when we have an excess amount of sodium, this also doesn't allow the calcium to properly do bone growth at the correct rate, right? At the right level. Also, low potassium levels can affect bone growth. So potassium actually helps neutralize the acid load from the typical Western diet, which is the high protein from animal and processed foods. So this creates this higher acid load where potassium can help neutralize that. So keto diets and carnivore diets, which are usually high in animal protein, low in fruits and vegetables, high in some of these fats, this can actually promote calcium loss from the bones. And so studies show that people who have adequate potassium intake, often from these plant foods, will have reduced markers of bone breakdown. So when we look at the effects of these minerals, once again, excess phosphorus occurs when calcium is low and the body balances, and there's studies that show this. I'm just bringing up some studies so you can see that the data confirms that the dietary pattern of many Americans are at high risk of developing osteoporosis because of the high phosphorus diet and the low calcium. So also there's more studies. You can look at the feedback loops. They talk about the homeostasis. Here they're talking about how the parathyroid, once again, begins to pull that calcium from the bones to equalize. In this case, you're looking at the high phosphorus in the diet from a typical Western diet. So if we look at calcium in general, the amount of calcium, the most the body can absorb at one time is anywhere from 450 to 500 milligrams. That's the approximate absorption rate. And the typical calcium that's most popular is calcium carbonate, which should be taken with food. And the calcium carbonate is the most common, it's the most cost effective, and it's probably not the most absorbable. I think calcium citrate shows in studies as being more absorbable, and it's actually can be done with or without food. Calcium carbonate is better with food because you can have some stomach upset with that one. It can create some issues. But with calcium citrate, it's better absorbed. It's good for people who have low stomach acid, people who are taking medication for GERD. The calcium citrates are more preferred. Also, there's other calciums, but they're not as absorbable. The calciums also from some of the oyster cells, calcium phosphate, they have moderate absorption. So typically the calcium citrate is the one that I consider to be the best, most popular, easier to get hold of. But remember, just because you're taking calcium doesn't mean you're still going to have good bone growth. Also, I want to mention there's a lot of calcium fortified in some of our foods. I'm showing almond breeze, which is almond milk. A lot of people don't realize 1 glass of almond milk has 450 milligrams of calcium. And back to how much calcium we need, anywhere from 1,000 to 1,200 milligrams a day. So if you look at 1 glass of almond milk, you're at 450 milligrams, almost half your day's worth. And then some other foods you'll see fortified. This is Kodak pancake mix, has 210 milligrams of calcium. So I guess you could have 2 pancakes and a glass of almond milk and almost be at 100% of your days of calcium just with fortification in some of our foods. Now we know that we talked about some of these cereals. They do have high levels of phosphorus, so it's interesting that they fortify them with some calcium. So right there, I think the food companies are trying in some of these foods that they're fortifying to help reduce some of this phosphorus load by supplementing or fortifying the foods with the calcium. So when we look at magnesium, high magnesium levels can actually inhibit the transport of calcium across the intestinal wall, reducing calcium uptake. So taking high levels of calcium, ideally you want anywhere from 300 to 600 milligrams of calcium or of magnesium. We get that in a lot of food. Restless leg syndrome, because magnesium is involved in muscle contraction, same with calcium. Magnesium deficiency a lot of times can be very prevalent. It is an electrolyte. We're not going to have calcium deficiency in the blood because you will always be pulling it from the bones, but we can have a magnesium deficiency. So a lot of times I recommend my patients to take a magnesium supplement, 300 to 400 milligrams, just to make sure we're getting enough magnesium, because that's a mineral we can do a whole entire podcast on, and some of the attributes of making sure you get enough magnesium. But all I'm trying to show here is the relationship of these minerals to each other and to the ability of calcium to do its job in the bone, right? It needs all these minerals to create this great bone building. So also there's been some studies that show a high phosphorus diet. Now remember, I talked about high phosphorus diet being with a processed diet, high animal diet. There's been some studies that shows that it does lead to bone loss and also cardiovascular morbidity. So some of these studies show that when we have this high level of phosphorus in the blood, like in this study shows, the relationship between phosphate level and cardiovascular event rate in people with coronary artery disease. So they found in this study, we found a graded independent relationship between high levels of phosphate and the risk of death and cardiovascular events in people that had a prior heart attack. And most of them who had elevated phosphate levels, and some of them had them elevated, and even some studies showed in the normal range. But they particularly talked about in this study that they saw an association. So phosphorus, high levels, again, seems like there's some relationship there in cardiovascular risk. I just want to mention fluoride. You know, a lot of people think of fluoride as a bone, part of bone growth, but it's a promoter, but it's not necessarily necessary for bone growth. It does interplay with the calcium's role, but actually fluoride just sort of stimulates bone. It's almost the saying, you know, let's say you're going to walk a mile. You do it a lot easier in running shoes than you would in your, work shoes, but it doesn't stop you from walking a mile because you have different shoes. Well, that's kind of how I think of fluoride. It kind of enhances bone growth and bone health, but it's not a real player. So studies with animals that have moderate fluoride can actually help with some bone quality, but the problem is excess fluoride. And this again, here we go, talking about these minerals not being in the correct balance, but an excessive amount of fluoride can actually harm bones. It can lead to an abnormal growth. And again, this is referred to as poor mineralization. So in a lot of these minerals, the point I'm making is all about the balance. Megadosing on some of these minerals, which I know a lot of people don't think there's harm in that, but actually there is harm in not getting the appropriate balance because it can affect the homeostasis, as I'm showing with bone, in other areas. So a lot of people will do megadosing, and megadosing on vitamins that are water soluble typically are not a problem. The body excretes them, vitamin C, your B vitamins. But some of these minerals are not water soluble. They're stored in the cells. So taking excessive amounts can be a real problem. Also, you don't have to take, the exact amount of these minerals every day because a lot of these are stored. And when they're stored, it means you can have maybe oysters one day that have a high level of zinc or some of these other minerals, and then maybe you don't eat them for 3 days, but you do store some of that. Okay, so that's one of the positive signs when it's not water soluble and it's stored in our cells for us. Okay, the body excretes excess calcium, so that's important to know. But there have been some studies that show excessive amount of calcium supplementation, not so much from food, but when you're looking at anything from maybe 2,500 milligrams, so somebody who's really taking a lot of calcium, maybe they saw a commercial and they were taking some supplement, which I see all the times, promoting a lot of calcium because it's going to be good for muscles and it's good for nerves, and it is all good for that, but it's way too much. Maybe even in combination with the foods they're already eating. And maybe they're up over the 2,500 milligrams. And this can cause adverse effects, gastrointestinal discomfort. So even a lot of people that take calcium supplements can have GI problems from the supplements, not necessarily from the food. It can also increase the risk of kidney stones. And also there's some studies that show there could be possible cardiovascular risk with high chronic doses of supplemental calcium. And where I've seen some of these studies has been in relationship to soft tissue calcification. Now, soft tissue like arteries and valves and things that are not meant to be turned into bone, we don't want our arteries, we don't want our soft tissue to be bone-like. Well, this is what calcification is. It's where some of this plaque and your arteries can actually calcify. And some studies are showing that possibly excess calcium can deposit in these soft tissues like arteries and heart valves, and possibly having a link to causing this artery calcification. Now, there's some studies that show that there is no link, but there are some that show there is. And so, as a dietitian, I feel like I should bring you both the science. So there is some dietary concerns with calcium that's abundant, especially in the supplemental form, and that could have a link.
Scroll your screen up a bit. It's been...
Is it there?
I think so.
Okay. I've got
No, you need to zoom out. You need to, it's too far up.
Okay. Let me see if I can work my screen a little better. Thank you, Sammy.
You didn't fix it.
I didn't fix it?
No. Oh, there.
There we go. Did I fix it now?
Yeah.
Okay. So let me go into some of the studies. So I apologize if you're watching this and you missed some of the, couldn't see some of the screen. So calcium from food is protective, but possible calcium supplement is associated with risk. And this comes from Johns Hopkins. And it talks about effects of calcium on heart and valve systems. And it shows that possibly in older people that maybe take in too much supplementation, there could be a risk for some of this calcification deposits in the bone. And more studies, again, talk about calcium intake from diet and supplement and the risk of coronary artery calcification. This is from the Journal of American Heart Association. The conclusion in this study was that high total calcium intake was associated with a decreased risk of atherosclerosis long term. They did show that. However, calcium supplement may increase the risk for cardiovascular events. So when we take calcium, this is good for heart disease because it's shown that it can improve blood pressure, because remember I talked about calcium is an important mineral for heart function, heartbeat, nerve impulse, muscle contraction. So we want calcium in the blood, but in its relationship to bone, there is a balance with all these other minerals that are so important. So this study again talks about some of the risk of high dietary calcium and relationship to artery calcification in older adults, just kind of highlighting some of the studies that do show this. Bottom line, and why this video I feel is important, is to understand that calcium levels and calcium supplementation don't really tell the whole story. And it's about bringing in, how's that? Much better? Mm-hmm. Okay. Thanks, Sammy. It's about bringing in the balance of these other minerals. And to the extent that we're understanding a lot of this supplementation.
You gotta zoom in a bit more to zoom it. There you go.
There we go. The deficiency, zoom out, zoom in, zoom out. Okay, awesome. Thank you. So deficiency levels of the magnesium, potassium, vitamin D, vitamin K, copper, zinc, elevated levels of phosphorus, sodium, all these compromise bone growth. So when we look at some of the foods, because I wanted to really talk about just eating a balanced diet can have a significant value. Hold on a minute. I always have problems with some of these PowerPoint. Okay. Hold on a minute. I'm going to have Sammy help me here.
There you go.
All right.
Step your mouse, right?
Okay. I think so. Shoes.
Okay.
There we go.
Zoom out.
Good.
Yeah.
Zoom out.
Zoom out.
There we go.
Scoot it over a bit. You have it too. There you go.
There we go. Perfect. Sorry. Apologize for that. Let me make sure I can get to the other ones. All right. I'm on my takeaway here. So, here we go. Yep.
You have it off screen again.
I have off screen? Okay. There we go. Sorry. So bottom line, we're almost done. So I'm just going to do the takeaway. Highlights is most of these minerals are in a balanced diet. You got meat, beans, lentils, mushrooms, chickpeas, tofu, potatoes, grains, leafy greens. All of these foods, potatoes, spinach, chicken, apple, orange, pears, plum, broccoli, leafy greens, almonds, rice, tofu, all of these foods in balanced amounts, I'm not talking excessive amounts, you can meet a lot of your RDA, okay, your recommended daily value. But if you're eating a diet that's not balanced, that doesn't include a lot of these vegetables, fruits, healthy sources of food, and you're eating a high processed diet, or you're really limiting to a high animal diet, chances are you're going to have deficiencies in these minerals. And having deficiencies in these minerals ultimately means bone loss. So I hope this helped. I also want to highlight that you can always get me at Myrna Method for more information. I have a whole course there where I help you balance the macronutrients. And also you can get my book on Amazon, Why Your Diets Fail and the Science That Really Works. So I hope this was helpful. Sorry about some of those IT issues. Thank goodness for Sammy. Until next week. Don't forget to like and subscribe. I always forget that, but of course that's so important. Until next time, thank you very much.